From the Cronkite studios in downtown Phoenix, this is Cronkite News.
Welcome to this Cronkite News special. I'm Cassie Rhonda. Thanks for joining us. As part of our Cronkite News mission, we focus on specific content areas important to our Arizona viewers. Tonight, we highlight reports from our Consumer Beat, stories on protecting your health and your way of life.
Drug overdose is the leading cause of accidental death in the United States, according to the American Society of Addiction Medicine. Now, doctors and patients are turning to alternative forms of treatment to ease pain and reduce the need for powerful and sometimes deadly painkillers. Reporter Kate Pfeiffer investigated the trend and joins us live in the control room.
Prescription pain relievers account for more than 40% of all drug overdoses, and more than 1.9 million Americans are addicted to prescription pills. But some chronic pain patients are turning to alternative forms of treatment for relief. Eric Johnson lives with fibromyalgia and myasthenia gravis, or muscle weakness, and chronic pain syndrome. He's one of nearly 100 million Americans that have constant pain. For relief, he takes medical marijuana.
It really helped. It helped to the point where I stopped Lyrica and I was taking a very low dose of tramadol, and most of the time none at all.
A study by the Journal of the American Medical Association says opioid overdose death rates decreased by almost 25% in states that legalized medical marijuana.
Patients were using responsibly, using cannabis instead of using opiates. And as we see with the 2014 JAMA article, patients not using so many opiates means less people die.
And it's impossible to overdose on cannabis.
And that's the problem with the opioids, of course, because that's where our center for breathing and our heart is controlled through the brainstem. And that's where you get those accidental overdoses that are occurring in droves and has become the #1 cause of accidental death in the United States.
Dr. Stephen Sywick says there needs to be more pain management education, starting with doctors.
Many of these overdoses are in fact accidental because the patient hasn't been made fully aware of the potency of these medications.
Although Johnson finds relief in cannabis, it's not a viable option for everyone. Instead, some patients turn to the pain center for treatments such as epidural injections and compression therapy.
If I can get your swelling down, the pain relieved with these interventional types of therapies, then I'll be able to concurrently wean down those opiate medications.
Other forms of alternative pain treatment include acupuncture, chiropractic manipulation, meditation and yoga, supplements and vitamins, and massage therapy, among others. At the University of Arizona, researchers are looking into other opiate-based treatments that relieve pain and prevent addiction.
We wanted to develop a novel compound that inhibited the pain but was non-addictive. So our compound isn't necessarily to treat people who are already abusing opiates, it's to prevent them from getting addicted to opiates in the first place.
It has been successful in animals, but it will take years of additional testing to make it to market.
Now it is very exciting to think 10 to 15 years in the future down the road to see our compound or something similar actually help those 100 million people who suffer from chronic pain.
Many chronic pain patients fear that the national attention on addiction will keep doctors from legitimately prescribing prescription pills for patients in pain. In the control room, Kate Pfeiffer, Cronkite News.
4 words parents never want to hear: your child has cancer. The Arizona Department of Health is providing resources to help families coping with that diagnosis. Reporter Allison Hoskins spoke with a mom that said the upcoming childhood cancer report can change lives.
When you first hear those words, your child has cancer, your first thought is, oh my gosh, will my child survive? And then you worry about all the other things.
Patty Luttrell is the co-founder and executive director of the Children's Cancer Network in Arizona. She knows all too well what it feels like to hear that your child has cancer. Her son Jeff was diagnosed with leukemia when he was 5 and battled it through multiple relapses.
Initially it was the leukemia, ALL leukemia, which is the most common form of cancer. And for some reason it was very difficult to treat. But 2/3 of all kids who go through cancer treatment have secondary effects. And one of those things that can occur is secondary cancers. So after 9 years of being cancer-free, Jeff then started with secondary cancers. And he's been dealing with that for the last, since 2009.
Families seeking financial, physical, and emotional support will soon have a report that wraps up all the resources they so badly need.
We really wanted this to be a community-focused report. We didn't want it to just be data and charts and graphs. And so we wanted to provide some community resources to families and to survivors.
Resources some families need at their most desperate time.
When my son was in bone marrow transplant in Tucson, the little girl next door to him passed away. And the family didn't have money to put gas in their car to get home after everything was kind of settled. So we gathered money that night and gave it to the family.
Families will now have one place to find the help they need. Wozniak says the ADHS is aiming to release the report in January. In Phoenix, Allison Hoskins, Cronkite News.
Kids might see the school nurse if they have a stomach ache or scrape their knee, but some have more serious medical conditions that require them to see a nurse on a regular basis if there is one. Natalie Tarangioli tells us how school nurses help keep kids avoiding the doctor.
Angel sees the school nurse at Starlight Elementary at least twice a day.
It's because I am diabetic.
The third grader needs the nurse to help him with his insulin shots.
They're actually really nice.
Cartwright School District has a nurse in each of their 21 schools, but this isn't the case nationwide. The Centers for Disease Control found that only about half of public schools staff full-time nurses.
It's very helpful. It can help student achievement. It can help make sure that students are healthy, and we know that students need to be healthy in order to learn.
Arizona schools aren't required to have a nurse on site.
I think a lot of times it does come down to resources. Obviously here in Arizona, that's been a need for our schools, and so they don't always have the opportunity to place a nurse in every school, even though I'm sure they would like to.
More than half of children in Arizona are considered low income, according to the National Center for Children in Poverty. School nurses can treat children when a trip to the doctor isn't a financial option.
They rely on school nurses for so much. You know, a lot of them do not have their own private physician or pediatrician.
At Cartwright, each nurse will treat anywhere between 50 and 100 children per day.
Stomach aches, headaches, oh boy, itchy eyes, scrapes.
And they see plenty of kids that need to be seen regularly, like Angel. Eventually, he won't need help with his shots, but if it wasn't for the nurse at school now,
I'd have to go back to the doctor and usually stay there.
In Phoenix, Natalie Tarangioli, Cronkite News.
The Department of Education isn't looking to make registered nurses in schools mandatory. They said it's up to individual school districts and their communities to decide to allocate funding for nurses or something else like extracurricular activities.
If you haven't gotten your flu vaccine yet, now is the time. Reporter Dana Lewandowski explains why the CDC is recommending only one option for flu protection this year.
My girls always freak out when they hear the word shot, and so we know, well, the nasal spray has always been available, well, at least the past few years.
But that may not be an option this flu season. The Centers for Disease Control and Prevention and the American Academy of Pediatrics say that the flu vaccination in the mist form isn't recommended this year.
They found out that over the last 2 to 3 years, the efficacy of the nasal flu was actually less than what was expected, and even to a very low number, that this year they're recommending that we give only the injectable influenza.
In recent years, the nasal spray method represented 1/3 of all vaccinations given to children to avoid the needle. One parent believes that even though she knows her children have to get vaccinated, she doesn't want to deal with the suffering her child will go through.
That has a huge impact on whether or not we even go back to get the flu shot, because I don't want to have another giant meltdown and be afraid.
The Centers for Disease Control and Prevention said that each year, about 20,000 children under the age of 5 are sent to the hospital because of the flu. They also said that 85 children died after catching the infection last year. Although less painful, some parents never considered the nasal spray vaccination for their kids.
I would go with the actual shot. I just think it's more effective on them.
While the nasal spray still may be available to patients, the level of its effectiveness has caused doctors to suggest against it and get the vaccination the old-fashioned way. In Phoenix, Dana Lewandowski, Cronkite News.
The Arizona Department of Health reports there have already been 38 laboratory-confirmed flu cases in the state since the beginning of the summer. With so much focus on prescription drug abuse and illegal drugs like marijuana, it's easy to forget about the simple act of smoking a cigarette. It's the #1 cause of preventable death and disease in the U.S. But a new report from the CDC shows young people in Arizona don't want to be part of those statistics. Reporter Allison Hoskins tells us why millennials are kicking the habit.
When you're older, you may be like, okay, well, I'm getting older, like it's whatever. But when you're young, like your body is still so pure that you don't want to ruin it or damage it that young.
And a new report released by the Centers for Disease Control shows that more Arizonans think like Gabrielle Hester. Cigarette smoking has hit an all-time low of 14%. And in the past 5 years, there's been a steady decline in smoking by 18 to 24-year-olds.
Smoking isn't quite the norm that it used to be. So a lot of our work and our policy and advocacy have created, that norm or that image that it's not the norm to smoke.
2014 to 2015 saw the biggest drop in millennial smokers of 7.4%.
My mom did smoke when I was younger, and I saw how much it like took over her life. And like anywhere we were, she's like, "Oh, I have to go take a smoke break," and it was just like, I don't want that to be my life, you know. So that kind of influenced me for sure not to get involved with tobacco.
The American Lung Association is trying to reach the younger generation that wants to quit.
About 19,000 people try to quit each day. So we have come up with resources that are available to anyone trying to quit, whether they want to attend a class or want to do it from the comfort of their own home and do a program online or with the mobile app.
Hester believes campaigns against even starting smoking have made a difference.
Back in the day, for sure, it was definitely like an everyday thing and everyone was doing it. But now I think it's just really with all of these truth campaigns and health and everything, everyone's just kind of like not really into it.
In Phoenix, Allison Hoskins, Cronkite News.
For more information on how to quit and where to get help, visit www.lung.org.
This is a box that showed you a world beyond your own. It was just a box, but the world has changed, and so have we. And now the box can be almost any size or shape. And you decide what you want to explore. Anytime, any place. Break out of the box with PBS.
A Valley teenager who is a 3-time leukemia survivor helped celebrate a life-saving trend today: teenagers donating blood. Reporter Allison Hoskins was there as the United Blood Services honored the High School Blood Drive Challenge, which helped recruit more than 21,000 teenage blood donors last school year alone. Allison?
1 in every 6 blood donors in Arizona are teenagers. United Blood Services High School Blood Drive Challenge is helping teens donate and raise awareness about blood donation.
I just bring out the awareness that blood is very important, that you never know when you might need it or somebody in your family.
Haziel Almeida is a 17-year-old senior at Metro Tech High School and is vice president of his school's blood drive committee. For him, blood donations and blood drives hit close to home.
I was diagnosed in 2008 with acute lymphoblastic leukemia, and I went through intensive treatment for about 3 years, chemotherapy, and then by October 7th, I was cancer-free. And then 2 months passed, and October 31st, I relapsed. So it was scary Halloween.
Almeida can laugh about it now because after 2 relapses, he's cancer-free and has been for 3 years, thanks to intense treatment and the help of over 135 blood donors. Donors like Taylor Williamson. She's a senior at Highland High School, and her school has held the record for the most blood donations for the last 9 years. Williamson joined her school's blood drive committee to help prepare for her future.
I want to be a nurse when I'm older, so I'm really interested in medicine. I want to do as much as I possibly can to learn about medicine. So we have a class at our school, community service. It's called GC 105, and that's where I learned about blood drive, and I joined it, and ever since then I've loved it.
The celebration at Chase Field also inspires schools to continue to give.
Today, we're not only celebrating their accomplishments from last year, but we're also kicking off the school year with the Blood Drive Challenge so that the teens that are going back to school can organize blood drives across campuses all over the state this year.
United Blood Services has been doing the High School Blood Drive Challenge for 10 years. Nearly 200 schools participate, and they're hoping more students sign up to be heroes.
Ever since I went through my cancer, I just feel like it happened because I have a purpose here. Like, I just feel like it's just made me aware of the importance of not only blood, but bringing awareness to anything that you find important in your life.
To learn more about the United Blood Services High School Blood Drive Challenge, how you and your school can get involved, or how to donate, go to cronkitenews.azpbs.org. In the Broadcast Center, Allison Hoskins, Cronkite News.
September is National Recovery Month for people with mental and substance abuse disorders. Cronkite News reporter Kate Pfeiffer caught up with one Scottsdale woman who turned her past addiction into a good cause.
Barbara Brown was just 14 when she started abusing drugs and alcohol. Today, she does everything she can to make sure people get the help they need. 26 years ago, Barbara Brown got a sobering phone call from her younger sister.
It was, we're finished. If you don't get help, that's it. And she slammed the phone down so hard I can still hear it ringing in my ear.
It was the first time in 24 years that Brown admitted she was addicted to alcohol. Today, she says it's a miracle she's alive.
It all had to stop, or I was going to be dead.
Brown says she owes her life to recovery. As a result, Brown and her late husband founded the Art of Recovery Exposition, an event to educate, bring awareness, and offer help to those suffering with addiction. One of the exhibitors at the expo, 5A, is a transitional living center. Joseph Mays, executive director, says the expo is a great way to let people know help is out there.
And they get an opportunity to go into this large hall and see all these different organizations and kind of like, oh wow, I could really use this kind of help, and I could use this kind of help. And wow, I didn't know that this was even available in Phoenix.
Brown says she loves every minute of her recovery and hopes events like the exposition help others do the same. Brown says Saturday's expo at the Phoenix Convention Center will showcase treatment options for many types of addiction, from alcohol to gambling, and will have a focus on youth and adolescents. In the Broadcast Center, Kate Pfeiffer, Cronkite News.
Mayors from Phoenix, Mesa, and Tempe were among dozens of leaders who signed a letter today urging Congress to approve emergency funding for Zika research. Meanwhile, Arizona researchers are also working to get a better understanding of the virus, which can be especially dangerous for pregnant women. Cronkite News reporter Zach Moran gives us an inside look.
It's called the Aedes aegypti, and it's the mosquito carrying the Zika virus in Arizona.
We are certainly at risk of Zika entering into Arizona and being a problem.
Michael Reilly runs this mosquito research lab at the University of Arizona. It's home to thousands of mosquitoes. About 50 are intentionally infected with Zika for testing.
We're one of the few labs that are capable of actually infecting the mosquitoes with different disease agents, specifically with the dengue virus and the Zika virus.
There are now 30 travel-related cases of Zika throughout the state. Maricopa, Pima, Pinal, Yuma, and Cochise counties all reported cases of the virus this year. And 2 hours north of Tucson is this state laboratory where scientists are working to find answers on this virus. Researchers at this public health lab run tests on blood samples from residents who may have traveled to Zika-infected areas. They hope that these clinical tests will lead to new information and that they will better prepare the public if an outbreak were to occur.
Zika virus is a really scary disease because we're still learning about it, and we know that it can cause some pretty severe outcomes for pregnant women and their babies.
But this has yet to cause concern for some pregnant women around the state.
I thought it was another overinflated scare. You know, I haven't heard about Ebola in a while now, and it just kind of disappeared and phased out, and I feel that this could be the same thing.
Tedesco has 8 children, and she's pregnant with her 9th. She's encouraging other pregnant women to enjoy their pregnancy and not let this threat get to them.
I'd probably tell them that it's not a huge concern, and that there's other things to maybe be more vigilant about than Zika virus.
Health officials say that pregnant women should speak with their doctor if they're concerned, but they remain confident that Zika will not become a widespread disease in Arizona. In Phoenix, I'm Zach Moran with Cronkite News.
Officials are urging residents to wear insect repellent and to get rid of any standing water that may be left in containers outside.
Valley fever affects Maricopa, Pima, and Pinal counties more than any other county across the U.S. Cronkite News reporter Natalie Tarangoli met with the University of Arizona doctor who is setting up new guidelines to detect the infection early.
These new guidelines are expected to cut down on the unnecessary medical and treatments that often happen because the fungal disease is often misdiagnosed as a bacterial one, like pneumonia. Carla Gargiulo relies on 3 inhalers and a breathing machine just to get through her day.
It's like this kind of vicious cycle that I'm kind of stuck in right now.
She was diagnosed when a CAT scan showed a 2.5 centimeter nodule on her right lung. Doctors didn't initially recognize the symptoms as valley fever.
I had a chronic cough. I was extremely tired, more tired than normal. My joints, I just didn't feel good.
Coccidioidomycosis, more commonly known as valley fever, is an infection that occurs when spores found in soil are inhaled. Dr. John Galgiani from the University of Arizona published new guidelines for treating this potentially debilitating disease.
These guidelines in many respects reinforced what we said before. They specifically ask questions. It's if you have a patient with a certain set of symptoms, do you start an antifungal drug or not? And then there's a basis for why that answer is our recommendation.
Gargiulo says she never thought of the possibility of having valley fever, even after multiple hospital and urgent care visits, until she was finally diagnosed with an infection she will have for the rest of her life.
Can't sleep upstairs. I have to sleep down on the couch because I am so short of breath I can't even walk upstairs.
Dr. Galgiani said the best thing people can do is be aware of the symptoms of valley fever.
There really is nothing you can do at the moment other than know about it, which actually is extremely valuable.
So if you're experiencing cold or flu-like symptoms, along with joint pain and possibly a rash, you should ask your doctor to test for valley fever. Dr. Galgiani hopes to see a vaccine made available sometime in the near future. He thinks one for dogs, who are 3 times more likely than humans to become infected, could be available as soon as 5 years from now. Live in Phoenix, Natalie Tarangoli, Cronkite News.
The FDA just released new recommendations that all donated blood be tested for the Zika virus. Reporter Samantha Witherwax headed out to United Blood Services in Scottsdale to see how they are following the advice.
United Blood Services assured me that they're working hard to get the FDA recommendations in place, but because they are a national organization, it will take some time to begin automatic testing.
We have been asking all donors during the interview process whether they have traveled to a Zika impacted area, and if they have, their blood is automatically tested for Zika virus.
Back in February, United Blood Service asked people who had traveled to areas with Zika to wait 28 days before donating blood. That ban was lifted in the middle of July, and they are now accepting blood, but it will be tested. Rio Olympic volunteer and future blood donor Serena Christensen agrees with this process.
Any recommendation they have that's at people's health and it's putting that at the forefront, I think it should be honored and it shouldn't be challenged in any way.
Sue Thu with the United Blood Services says they are currently in the process of reviewing the FDA recommendation.
Obviously, we're a national company. It's not something that we can just flip a switch overnight. We have 4 weeks to implement the testing, and we're in the process of setting up all the policies and procedures needed and training for our staff.
According to the Arizona Department of Health and Centers for Disease Control, the 25 Arizona Zika cases that have been confirmed can all be linked to travel, and the only state that has non-travel reported cases is Florida.
We are doing automatic testing in Florida, and we'll be implementing within 4 weeks the testing on all donated blood right here in Arizona.
I think the urgency is high and it should be high.
Currently, United Blood Services has 13 tests in place for all donated blood. It takes 24 to 36 hours to test that and release the blood to the hospitals. And the good news is that testing for Zika would not slow down that process. In the broadcast center, Samantha Witherwax, Cronkite News.
Rising opioid abuse has led to an increase in the spread of diseases from shared needles contaminated with STDs. In a 2015 study, the Center for Disease Control found opioid users were 21% more likely to become infected with hepatitis C. Jesse Canales found out what one group is doing to stop the spread of diseases from shared syringes. Jesse?
After watching their friends and neighbors become infected with diseases through shared syringes, a group of people formed Sonoran Prevention Works. Their goal? To bring awareness to the public how to safely clean and dispose syringes.
The alcohol wipes are used to prevent abscesses.
Something as simple as a Band-Aid or alcohol wipe can make all the difference in the spread of diseases among opioid users. Many users are not taught how to clean their syringes and end up sharing infected syringes, spreading diseases among themselves.
I was getting tired of seeing that and seeing them struggle. I knew I wanted to help.
Sydney Craig says she always wanted to be a nurse, and her mother's bedtime stories of nurses in the 70s who did the same thing were one of her inspirations to stop the spread of diseases among opioid users.
I remember thinking of how awesome and how cool they were and how I wanted to do that. And this is kind of my way of doing that.
The group puts together and hands out harm reduction kits to opioid users to stop the spread of diseases from shared needles. Many of the items in the kits are available at pharmacies, but opioid users said they were denied access to them.
People felt dehumanized and they left and shared needles with other people. That's just kind of the recurring theme throughout people who are infected with hepatitis C through needle sharing in Phoenix.
As of now, Sonoran Prevention Works does not hand out syringes. They say they look to do that sometime in the future. In downtown Phoenix, Jesse Canales, Cronkite News.
That's it for this special edition of Cronkite News. For top Arizona stories anytime, go to cronkitenews.azpbs.org.